Lori is my volunteer. She's fostering Libby, and she's been doing all those exercises with her.
Oh, that's you. Well, you
Yeah.
did a good job.
She did a great job. Look at her.
Yeah, so I think overall, she healed really well. She looks good. The only thing is, obviously, we need to keep working on that leg. I think what you're doing is great, considering it's 2 weeks, and plus she has those pelvic fractures as well, so she's doing well. The only thing, if it's possible, maybe we can do some stretching exercises.
Okay.
You may need help to do that because she doesn't like it. It's like if you and I go to physical therapy, we need to pull it to a point where it's uncomfortable and keep it
Those
there.
are the range of motion ones where you pull it as far back as you can, as far forward as you can.
Can you hold her for a sec, Genesis? So you can do it on the side, or you can do it standing up. Let's put her on the side, maybe. So if you have help. Has she lost weight, or she always been this
She's
skinny?
gaining weight.
Yeah, she's filling out a little.
So this area, that's the hip, right? That's
Yeah.
where the surgery was. So that is the area that we want to make sure we stretch. Obviously, this is the ankle and this is the knee. So if we just do that, that is good, but we're mostly taking care of the knee. So we really want to take care of the hip. So what I do is I put a hand around the knee. Just lay my hand on top of the hip and then pull it back. So this is flexion, okay?
Yeah.
She's okay with that. It's extension that is an issue. So that she's getting to get a little bit of stiff. So I'm gonna pull back a little bit more. She's okay, and then pull back a little bit more. That she gets a little bit uncomfortable there. So I'm gonna keep it there for a few seconds, and that's okay. Release it and then do it again. If you do 5-10 times, once or twice a day, that helps. Well, what you do is increasing her extension there, okay? And we may have to keep her a little bit of anti-inflammatories for a little bit longer.
Okay. The carprofen?
Yeah, just because she's gonna be sore.
Yeah.
And then we can discontinue that. I mean, most of the inflammation is gone already. And, but yeah, I mean, I think what you're doing is really good. And if you want to walk her uphill as well,
that's what I've been
good.
doing.
Excellent.
And on sand.
Yeah, absolutely.
Lori's a pro with this because she had another Cocker Spaniel a few years ago, Miller, that she had to do.
Orthopedic,
Yeah.
Excellent. Yeah.
There she goes.
And
big
right now with this type of surgery, there's no implants or anything. The soft tissues are healed, so she can do whatever she wants as long as she's using the leg.
Yeah. Yeah.
So I think a couple of weeks, if you do those stretching exercises and all that, then that will help.
Good.
And she's probably start using her leg more and more.
I've been holding her good leg up and making her stand on the bad leg,
Perfect.
just to kind of, because she doesn't have any thigh muscle.
Muscle atrophy, yeah. And the
I mean, is
only
that really
way-
going to help her build muscle, or just her
Yeah.
walking uphill would be more?
Everything. Anything that is gonna make her put weight on it, you're using muscle for that.
Yeah.
So, and that's exactly the goal, make her build some muscle.
Yeah.
Once we have that, she's gonna start using her leg more and more and more.
And then that little lumpy thing over here isn't urgent that we get removed, right?
We aspirated it and that came back as fat.
Okay, so we can just leave that right
I
now.
would probably watch it because even though it's benign, it could grow.
Okay.
If you think it's growing relatively quickly, I'll just have it removed.
Because it's actually on the mammary, right?
It's exactly, and that's why we aspirated it, making sure it wasn't something, but it came back as fat.
Okay.
So we decided to.
You got a little fatty boobie. That's okay.
Yeah. So, and I
No
will,
big deal.
but I will watch it. If it keeps growing, just remove it. And we know it's fat. They don't have to go crazy. We don't have to go just go around it
Okay.
and take it off. The other one that I was telling you about was this one right here. Let me see.
Yeah.
That one right there.
Oh yeah.
If you go deep.
Yeah, I
there,
feel it. Yeah.
But it does feel like a scar tissue, and it came back really non-diagnostic. So,
Okay. Yeah, I feel that, Lori.
Yeah.
so if we have that removed, or you have that removed,
Yeah.
they can. This is going to be a little bit more tricky because it's deeper. But the other option is just watch it. It's very
Yeah.
tiny, but if it keeps growing, it's like this little bit just have it removed.
Okay.
Because it's easier to remove it when they are tiny. And we
It's right
didn't find
here.
those until later on. You
Till after
when
she
we
was
shaved
shaved down.
everything.
You
So-
got some bumps.
Okay.
See, the text did a good job with the
They
shave.
did a great job.
When I
Thank
saw
you.
her, I'm like,
Yeah.
wow, you guys, I gave you a little credit, but actually she looks good.
She looks
does look
great.
good.
They did a great job. So in terms of what's next, does she need another recheck or just physical therapy?
Yeah, I will just continue physical therapy. Unless we see, that she's not really progressing.
Okay.
I usually recheck them a month later to see where they're at.
Okay.
But if you continue what you're doing and do the stretching in addition to that, I think that's gonna help.
Okay.
And I don't know if you have access to a swimming pool or something, and if she likes the water.
That would be
is
good too.
Yeah.
Like
exactly.
underwater treadmill or swimming pool?
Both.
Both. Oh,
We
okay.
have access to either one of those. They both work differently, but both
Yeah.
are good.
Okay.
Yeah.
All right. So do you want to see her in 30 days or?
Yeah, I mean, if that's possible,
Sure.
that would be good.
Yeah, and then in terms of getting her adopted, we need to prepare potential adopters for like arthritis when she's older.
Well, the main concern is,
She's so nice. She said Dr. Cabrera saved my life.
What are you doing?
That's a nice doctor that saved my life. She's so
Did
sweet.
you look at the extras? You never look at the extras.
Oh no, could you
Yeah. Can we?
Because we were gonna ask about that pelvic opening.
Oh yeah.
Hey guys, hi.
This is like, yeah.
Hi.
Hey, so help in the water.
Are you
So
videotaping?
whenever you're done here, so.
Yeah,
I'll
cuz
be right up.
Oh, good. Okay.
my Libby said do you need to go to an emergency, Dr. Cabrera?
Oh, it's just one of the surgeons. It's
Help.
a second hand out there.
Oh boy.
Should I be a scrub it? I don't know. It should just be a scrub it.
So in terms of, oh yeah, that's right, the pelvic opening. So her stools have been really good.
Uh-huh.
And I just need to know what to tell potential adopters.
Yeah. I think the thing that I will worry the most about is this. So if you look at her, this is, so this is what we did the FH on. Let me see what we have right here.
Oh boy, that's messed up.
Yeah.
Oh.
Yeah.
It hurts to look at that.
So this is the side that is affected, the right side. This is what we did the FHO. So what I was telling you about is the narrowing of the canal,
Yeah.
okay, which is about, a little bit less than 50%. It's about 50% where we worried, okay, this is gonna cause problems in the future with defecation, okay? That would be the main concern, okay?
Okay.
So I will tell them, maybe we can take an X-ray in a couple of months to
Okay.
see where it's at. Make sure it didn't form a little callus or something.
Okay.
It's not gonna change what we do, but it will give you information
For someone to adopt her.
Exactly.
Yeah, okay.
And that will be. Yeah, I can do a rectal fine. Everything feels fine. So it may never be an issue, honestly,
Okay.
but could be.
Yeah.
Okay.
Okay.
May have to keep the feces soft and things like that. But again, it may never be an issue.
Because she's
There.
having no problem. No, right? Okay.
Yeah, so I think you may be okay.
She'll be okay, all right.
So that would be the main concern. The other one is the bumps, the little
Yeah.
bumps.
And that's easy. We can have that removed if she ever
If
has a
there's
dental
problem.
or.
Yeah, exactly. And that's pretty much it. With her leg, the FHO is not really an issue. She's probably never gonna have a normal gait.
Okay.
But as long as we rehab her and all that, she should be. The main thing is to have her comfortable. She should be able to run, walk, and do her normal.